Hi, in today's video we're going to take a look at the muscles of the abdominals. We'll take a little look at diastasis recti, and we'll also have a little look at cesarean section and how to massage your cesarean scar. So first of all, let's take a little look at the abdominal muscles. When we think of the abdominals, a lot of people often just go straight to thinking about the abs on top and the muscle layers that are on top. So I want you to change or shift your mindset to, when you think about the core, we're thinking about these deep core muscles which form what we call the core canister. So these are the muscles which are responsible for controlling your intra-abdominal pressure. And in terms of aesthetics, if you don't have these muscles functioning well and in sync with each other, you're going to have issues with not being able to get your stomach flat. So let's have a little look at what these muscles are. You've got your respiratory diaphragm up the top, which kind of dictates everything. It's a very powerful muscle, and in terms of the flow-on effect that a weak or tight diaphragm can have on the body is just insane. It's a massive factor for health overall from head to toe. And then we have at the bottom there, we have your pelvic diaphragm. So your pelvic diaphragm is your pelvic floor muscles, which we went through last week, and your respiratory diaphragm and your pelvic diaphragm should, if everything's functioning well, move and work together. And that's what dictates this core canister. We've got the lid, which is the diaphragm. We've got your pelvic floor at the bottom. And then on the sides, we have your multifidus across the spine, which people are going, what the hell is that? Didn't know that was a part of your core. So this forms part of your core canister, which maintains your pressure inside your abdomen. And then we have this big one at the front, which is your TVA, or your transversus abdominis. The fibers of this particular muscle, which is that deep corset muscle, run transversely, so horizontally. And this is the deepest layer of abdominals that we have. So this is a huge muscle as well. It wraps all the way around to your spine, all the way around the front. Rib cage up here, you've got your pelvis down low, and it runs horizontally in terms of the fibers. So those fibers, when you have a nice strong transverse abdominis, they tighten and they flatten through the abdominal wall, which is, let's be honest, everyone wants a nice flat stomach. If you don't have a strong, well-functioning core canister and transverse abdominis, you're going to find it really hard to get a flat stomach. And then we have the muscles of the core, which most people think about when they think of the core. So you've got your rectus abdominis at the top, which is the muscle that forms that six-pack. And it's actually out of the muscles, it's probably the least important one of them all. So I know people just spend a lot of time training this particular muscle, and they isolate that muscle with crunches and all sorts of movements. But if you don't have the backup of that big transverse abdominal muscle working behind it, you're going to end up with a really strong rectus abdominis and then a really weak transverse abdominis, and you're never going to be able to get your stomach flat, and you'll probably put your back out if you have that sort of muscle imbalance. So it's important to train the deeper layers of your core first and foremost. Then we have, so let's start from the deeper layer. So you've got your deepest layer, which is that transverse abdominal muscle. So there it is there, big muscle which wraps right around from your spine. Fibers run horizontally. This is the muscle that's responsible for postural support, and it will help alleviate and keep you away from having troubles with back pain, if that muscle is nice and strong. Then on top of that, we have your internal oblique. So that's the second deepest layer. And then we have on top of that your external oblique. So you have your internal oblique, which runs quite low as well. And then you have your external oblique, which runs up a little bit higher over here. And this one sits on top of that one. The fibers of those run sort of opposite directions to each other, but they both run in that oblique line. And on top of that, you have the top layer, which is the rectus abdominis, or the six-pack muscle. So when we think of the core, I want you to try to shift your mindset from thinking too much about this picture here and think more of your core as this picture here, and that will help you immensely in terms of results as well. And when we take a look back at this picture, remember it's dictated by our breath. So that diaphragm and this diaphragm should be moving together. We're not going to go through how to breathe today or intra-abdominal pressure, so it's just too much to go through, but they will be in some of the videos coming very soon. So what happens when you have a baby? That rectus abdominis in the front there, as well as the muscles underneath it, are all joined by these connective tissues. So those white pieces here, that's all of your connective tissue, which is basically fascia. So you've got different types of fascia through the body. These ones here are more thick bands, but then you also have like spider web and glue-like substances of this fascia which run through the muscles, through the organs, they're everywhere inside of your body. But these particular ones here are thicker, and when we grow a baby, they, see that green line? That line there is called the linea alba. So this is the connective tissue through the front of your tummy, which we often refer to as the midline. So once your midline separates, which it will for absolutely every woman who is growing a baby, 100% of women at the end of their pregnancy will have a diastasis immediately after giving birth. So that's not too much of a concern, right? That's a natural part of growing a baby. Our baby needs to our body needs to stretch in order for that baby to fit inside our belly, which was once very small, and it needs to over time expand. So those connective tissues will allow that to happen. And then we still have our hormones running through our body, which encourage the connective tissues to stretch. And over time, those hormones start to slowly change back to our normal hormonal makeup, and we won't be so flexy through our connective tissues unless you have a diastasis recti, which looks like this. So this is an abdominal wall with everything that has come back nicely together. Perhaps they haven't even had a baby, and it's around the belly button there. You can see it's normal for it to be a little bit wider because we have our belly button. However, this tummy here has not closed back up post-pregnancy. So you've got that separation of that connective tissue through the middle, which is a diastasis, or a separation of the abdominals, and then often the tummy might look like this at rest. So it's not entirely flat. You can see some changes of the tissues there, and it just looks a little bit distorted. But again, that can just be skin, and it's also quite normal to have this type of look through your abdomen after having a baby, even if your abdominals are closed up, because it can take time to lose that extra body fat, and the skin might be stretched, and it can take time to come back together. But we have different types of diastasis as well. So this can reflect on how you carried your baby through the pregnancy. At the top there, you can see that this tummy is nicely closed, maybe hasn't even had a baby. And then we have a different type of diastasis recti shown in each of these 4 pictures. So through here, we've got a completely open diastasis where the connective tissue, not only through the middle, but also through those horizontal planes there, has been stretched and has not come back together. Then we have just above the navel here, so maybe this woman just carried really high, which is why it's only separated above the navel. This woman here has a diastasis below the navel, and then we have another version of an open diastasis here, which is just through the midline tissue, but not so much through the horizontal planes of the connective tissue. So over time,